Should you start getting mammograms at 40, 45, 50? Why is this so confusing? We will teach you all about it. Both women and physicians are confused and frustrated by the rollout of new guidelines about when to start getting screening mammograms and whether to get them every year or every other year or some other recommendation. There is a rationale for starting screening mammograms later than 40, which is the generally accepted guideline for many years. But I'm going to explain to you why we recommend you continue getting screening mammograms every year, starting at 40, until the dust settles on the issue. In this lesson, I'm going to show you how mammograms save lives. I'm also going to go over some of the actual risks of getting screening mammograms. I'm going to review some of the new guidelines and the controversies associated with them. And I'm going to teach you how to engage your physicians so you can make the best decisions for yourself. So let's get started. So how do screening mammograms save lives? Well, getting a mammogram when you don't have a lump in your breast, a screening mammogram once a year when you have no symptoms, helps detect small breast cancers and pre-cancers before you or your doctor can detect them. And it makes sense. Breast cancers, when they're earlier, are less of a threat to you, and smaller breast cancers we can cure more often than larger breast cancers. So why the controversy? Well, it is kind of complicated. And next time I'll explain to you the risk of getting screening mammograms. There are risks to getting a screening mammogram? Well, there are, and I'm going to walk you through them. Screening mammography, getting a mammogram every year when you don't have any symptoms, is really a balance between the benefits, saving lives, finding cancers earlier, versus the risk, which would be the cost and the stress and anxiety of having extra biopsies or the radiation from the mammography. So let me walk you through some of the risks that are talked about the most. Callbacks. So when you undergo a mammogram, they take 2 views of each breast, you walk out the door, and you get a letter saying, come on back, we want to take a little look into your breast. The radiologist is a little bit worried about something or wanted to clarify something. Well, that's stressful. It also is increased radiation to your breast and nothing's found, and you kind of feel like you go through the ringer and you're relieved, but still, you're put through a process, and it's pretty common. Biopsies. 80% of all breast biopsies are benign, not cancerous. So there are a lot of biopsies that we order and recommend based on something on a screening mammogram that prove to be nothing. So there's an argument that many of these biopsies were not needed to find cancer, so benign biopsies. The stress and anxiety of undergoing a mammogram, the discomfort, callbacks, biopsies, all of that, but the personal distress. There's a financial cost sometimes to you and to society of getting mammograms every year for so many women. And then there's an argument that some cancers would be detected earlier, but even if they're detected in 6 months when doctors could feel them or you could feel them, both would be cured. It's a weird argument. It's hard to apply to individuals. So there's a lot of concern about screening mammograms and whether the risks are less than the benefits. That's where mammogram screening guidelines come in, to give recommendations looking at all of the benefits and the risk. And that's what I'm going to cover next. And unfortunately, they're still confusing. So what are the new guidelines or recommendations for getting screening mammograms? When to start and how frequently to get them? Well, guidelines are issued by well-meaning societies and governmental organizations composed of smart physicians, nurses, epidemiologists, public policy people, number crunchers, to make recommendations. And for many, many, many years, the gold standard was really considered the American Cancer Society's recommendations to get a mammogram at the age of 40 and annually going forward. Simple to follow, easy to remember, it worked. About 5 years ago, the United States Preventive Services Task Force, say that fast, issued new guidelines suggesting that women start mammograms at the age of 50, and between 50 and 74 get a mammogram every other year and something different afterwards, and no recommendation when women are in their 40s, except for if they're deemed at high risk, but there's no standard way to identify people that are at high risk. That created a big uproar, a lot of confusion. It was so complicated that physicians didn't learn it, patients couldn't learn it, and there was a lot of political fallout. A few years later, the American Cancer Society also issued new guidelines recommending beginning mammograms at the age of 45, and every year until 55, and after 55 every other year. And then that was also confusing. All of this is important to put together, is that all these recommendations suggest that physicians identify women that are considered high risk in their lifetime for getting breast cancer. And that is a difficult task to really quantitate and figure out whether a woman's high risk to get mammograms in the 40s based on the new guidelines, or a little elevated risk but not high enough to do this. So the guidelines suggest beginning mammography later, identifying women that are at high risk, but all of it's so confusing, it's really created a lot of havoc in healthcare. So next I'm going to tell you some general principles about getting screening mammograms that we suggest that incorporate all of these principles. What is the take-home message about getting screening mammograms? Well, making informed decisions, which is the principle behind the Breast Cancer School for Patients, applies here. Educate yourself. You're already doing this by watching this video. Read through our content and the links, great links to many different sites on this topic, and look elsewhere. Engage your physicians. They know you best. Ask them what their recommendation is in general. Ask them what their recommendation is for you. Maybe you're a higher risk, maybe you're a lower risk. Ask them if they feel the benefits outweigh the risk of starting at 40 or 45 or 50. So stepping back, I'm doing my best to make it simple, is this. These are a couple of principles. Number one, I generally recommend, because people are individuals, not just society. It's easy to recommend something for everyone, but when you have to make a decision about yourself, that's a different story. Start mammograms, get them annually at 40 until the dust settles. If you're in this camp where you don't think that you're at high risk and you want to avoid mammograms, you don't like the feel of them, or it's painful, or you're worried about the radiation or the risk, then maybe you start at 45 or 50, engage your doctor, and there's a rationale behind that. If you're at high risk, you carry the breast cancer gene, or you've had biopsies that tell you're at high risk, or you have a very strong family history of breast cancer, ovarian cancer, and other things, then I would certainly err on screening earlier, starting at 40 and going forward. But again, most importantly, engage your physicians on the topic. Ask them what they think. Share them with them your thoughts and concerns, and make an informed decision for yourself. To learn more about when to start screening mammograms, visit the Breast Cancer School for Patients, where we will teach you everything you need to know. We're here to help you get the best possible breast cancer care in your community. Register on our website to get our list of questions to prepare you for your next doctor visit.